Hey guys, how's it going? It's Sunday, about 2:30 in the afternoon, and it's kind of after work. I say kind of because after my shift is over at 4, I'm going to be on call until 8 o'clock in the next morning. That's right. I'm back on call overnight. Just for tonight, and then Friday, Saturday, Sunday next weekend. So, there goes my weekend. But that's okay. I need the money. We actually didn't have too much in the way of visits to do today, but I thought of a couple of things just on my own I figured I should do, just checking up on the folks that I admitted on Friday, and just do a little bit of tweaking and fine-tuning and make sure everybody's, as comfortable and content as possible. But it looks like I'm going to have the week off, Monday through Thursday, so that'll be kind of cool. It'll give me time to catch up on schoolwork and things like that. I actually went ahead and did the final week's worth of the final week's discussion question a week early. It's almost week 7 starts this week, but I did week 8's discussion question just because it jumped out at me. I'm like, oh, I can answer that. It was we had to find an article of some kind on the web that illustrates like a big important issue in nursing that's not related to like medicine or treatments or technique or anything like that. And to my mind, at least, there is only one issue that's really even worth like talking about. An issue so big that all the other issues are, amount to fiddling while Rome burns or something like that. And that issue, of course, for those of you that have been keeping current with the nursing profession, the big issue is the shortage of nurses, which is a huge problem. The shortage of RNs and APRNs is just absolutely crippling our healthcare delivery system. And the causes of the nursing shortage are pretty complicated. There's a lot of ins and outs. You've got the rising average age of the population as a whole, and then you've got the high average age of the nurse, which I think is something like 45 years old for an RN and 55 years old for an MSN or an APRN or an NP or what have you. So this is a big problem because they're all getting ready to retire. So the outlook for the next 10 years of the nursing shortage is not very good at all. We're going to be short something like a couple million people in the next 10 years to license to administer medication. Just a huge crisis. And so going a step further than that, looking at what some of the causes of that are, because there's a shortage of master's degree nurses, there's a shortage of clinical faculty that are required to train nurses. You have to have a master's degree nurse. They can only supervise 8 students at a time in a clinical rotation, except we worked out like a cool little deal in Connecticut to let them supervise 16 nurses at a time with bachelor's degree nurse preceptors that are employees of the hospital. That's the clinical site. So, Connecticut's kind of a trailblazer in this kind of thing. But because there's a shortage of these master's degree nurses, you have stuff like, our local state university might have 1,000 people per year trying to get into the nursing program, but only room for 80 of them, 80, So there's no shortage of people who want to get into nursing. There's a shortage of people qualified to train them, which is, a huge crisis. So what's the cause of that? Why is that going on? And the article that I found that I discussed and posted a link to, it was actually, the issue that I wanted to get to was the difference in the lobbying approaches. The nursing professional organizations, there's like 5 national professional associations, 5 national professional associations for nurses. And nurses, by and large, don't even join them. They join their specific specialties professional association, like the Oncology Nursing Society or the Emergency Nursing Association or the Rehab Nurses Association or the Holistic Nurses Association or the Hospice and Palliative Care Nurses Association, and all these wonderful organizations that really do a lot to advance their field. But when you combine all of their lobbying influence is like spread out between all of those different organizations. You have to get those organizations to agree on lobbying priorities in order to compete with the American Medical Association, which, if I remember correctly, only contains about 10% of the licensed doctors. I think it's just MDs. Maybe they let DOs join too. I don't know exactly. But the point is, it's one monolithic professional association that has all of their lobbying influence consolidated, you know. So if you look at the lobbying approaches of nursing versus medicine, you see that, you know, even when they're drawing on the same appropriations and the same part of the government and this part of the same spending, the physicians are getting more money, and there's some differences in the lobbying approaches that can account for this. And this was the article that I found when I was like searching around in databases and stuff for information that tied all these factors together, and was not too successful in finding anything approaching comprehensive until I found a doctoral thesis written by a PhD in philosophy under the topic heading nursing science, and it's like 200 pages long or something, but it's actual like original research into this that involves interviewing both lobbyists and representatives of the government involved in appropriations and things like that. So, you know, I didn't read all 200 something pages, but the assignment was just to discuss the topic and like post an article that discusses the topic. I don't think the assignment was to solve all of the world's problems by Wednesday rather. But it was a pretty interesting read. I'll probably post a link to it on my blog if anybody wants to peruse it, because it does contain in the introduction a really lucid like summary of what the crisis is and why it's happening, and with some suggestions about you know, potentially what could be done about it. But you know, I mean, this whole thing definitely did motivate me to want to go back to school and to get my master's in nursing, because there's a a huge need for it, and there's a huge need for people to go on from their RNs and get their MSMs and train more nurses, because they're going to be in trouble otherwise. I mean, I don't know what they're going to do. As the nursing shortage has gotten worse and worse, they've been taking away things that we used to do and farming them out to unlicensed technicians, or professionals of equal or greater educational standing. Like physical therapists are prepared at the doctoral level, which is pretty impressive. I didn't know that until I started working with physical therapists, and occupational therapists are prepared at the master's degree level, which is great. And OTs are phenomenal and really important. And you got like respiratory therapists, and you've got nurses aides whose role is expanding because of the nursing shortage. And so, I mean, what's next? Med administration? I mean, they're already doing that in the social services, mental retardation population. There's not enough nurses to administer meds, so you just train the unlicensed, direct care group home staff how to do it. And, they're giving medications, and they do have an automatic blood pressure cuff, but they don't really know how to assess, and they don't necessarily know what the side effects of these medications are. And the main point is that they don't have the judgment to hold a medication. If it's necessary to hold a medication, they haven't been trained to do that. Yep, so that's what's going on in school right now. Blah, blah. I'm getting 90s and 95s on everything. Not too exciting. And on-call should be interesting. If I'm driving around late at night and interesting things have happened, I'll record another one of these at like 3 in the morning or something while I'm driving back from a call. But I think I did everything I got to do to make sure nobody calls me, at least on the patients that I've worked with throughout the weekend. So hopefully nobody will call. We'll see. And we'll find out soon.